Dr. Gassman, I'm ready to get started with you. Can you tell me what metastatic melanoma is?
Absolutely. Thank you. Well, first of all, I want your audience to know that most melanoma, which can be a scary diagnosis, is caught early and as such is very curable and very treatable. Unfortunately, for some patients, it can spread throughout the body and be called metastatic. That's when the body can't control the disease, and that's when it gets very dangerous. And I know we're going to talk about this in a moment. The good news is there's good news to talk about because there's been a lot of advancement in the field.
When you get a patient who comes in or any doctor has this, are there any ways of dealing with this, or do you just have to live with it?
Well, so I now work for a company that's advancing this therapy that we're going to talk about today. I was a treating physician for many years. And the good news is no one has to live with this. There are many options for patients. And the therapy specifically we're going to talk today about is really a therapy that is allowing patients to go beyond what we had before and hopefully giving remarkable outcomes like we heard for Chris. Although it's not it doesn't always work as well as it did for him. It does for many. And when it does, it really is incredible.
Okay, I'm going to switch and talk to Chris White just a few moments because he's gone through the therapy I'm thinking. Chris, can you share how you first discovered something was wrong and how did you get this diagnosis?
Yes, absolutely. So in the beginning of 2018, I noticed a lump on my body in a place where there shouldn't be one. And unfortunately, I didn't do anything about it. And then a few months later, I discovered another lump, and it was concerning. So I went to my doctor, who then referred me to a surgeon, and I had a surgery on that second lump, and that pathology came back as metastatic malignant melanoma. But the type that I have makes up 1% of all melanoma and is extremely rare, comes with a very poor prognosis. And so after I'd ran out of options, that's when I learned about cell therapy and qualified for one in a clinical trial. And that was in January of 2020, and that was 6 years ago.
How did you learn about cell therapy? I need to know that.
So I learned about cell therapy because I ran out of options. Unfortunately, I learned about it through default. So I got pointed in that direction as a one-time treatment. You know, my cancer was so aggressive that, you know, we had to stay very vigilant. So I had to advocate for myself and ask the questions. And unfortunately, I didn't know about this therapy from the get-go, or I would have tried to get to it a lot sooner.
Thank you so much for sharing. We're glad you're here to share. Dr. Gassman, tell me about current treatment options for people living with metastatic melanoma.
Sure. And I'd be remiss not to remind your audience that Chris's amazing, inspiring story is for a patient who lives in Dallas. We were just noting that a moment ago. There are a number of options right now. And the one that I think that has really been the biggest game changer, though, is the one that takes the body's own immune system, reinvigorates it, and allows it to then really work what it was trying to do, but it was inadequate to do so. Many of those therapies are off the shelf. What makes cell therapy and immune-based therapy also different is we take the immune system outside of the body, reinvigorate it, expand it there to levels the body can never do on its own, and then give it back to the patient. It becomes a living therapy. It's a single dose. You never get it again after that. And when it works sometimes immeasurably long, which is really why we're so excited about it today.
Are there any side effects to it?
So the therapy does have side effects, but they're very short-lived, and they're all reversible. And the bottom line is, we do have to tell patients that this is a therapy that, no therapies really have no side effects, and patients do need to be educated and certainly be warned about what they will go through to get the therapy. Ultimately, and I'm sure Chris can describe it more, over time, because this is a one-time therapy that hopefully will give years of benefit, certainly in the case of Chris, those side effects, as you describe them, usually are self-limiting and don't travel with the patient, but the therapy continues to work in the patient.
Anyone listening, anytime you have a glimmer of hope, doctor, you try to connect with it as Chris did. What are the key takeaways about this, and where can my viewers get my listeners get more information?
Sure. So I'm just going to reemphasize it's a one-time therapy. It's a living therapy. We've actually seen patients get benefit, and that benefit became even stronger years later, really emphasizing how it stays in the body because it's made from the patient for the patient. These are not modified cells. These aren't genetically altered. There's no other special things done other than to reinvigorate them outside the body. And so thus it's very natural. And ultimately, the biggest key takeaway is knowledge and getting patients and their caregivers to know what this is, to talk to each other. And websites like curemelanoma.org is a wonderful layperson's way of really getting to understand what this is all about.
I want to thank you and Chris, and I want the audience to know that Dr. Gatzman is the Executive VP of Traditional Medicine and Translational Medicine and Research, and Chris White is a successful survivor of all things. I want to thank you both for being here and talking about something that hopefully we hear a lot more about.
We agree, and thank you.
Thank you very much.
Hi, I'm Valder Beebe, host of The Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.